First off, I want to say that addiction is considered a disorder, not a disease. That's because addiction, or rather substance abuse disorder, is diagnosed by a pattern of behavior, not by a lab test. That better fits the definition of a disorder, not a disease. There is no addict gene, only susceptibility. I also want to add that addiction is not dichotomous. It exists on a spectrum. Not everyone struggles with substance abuse the same way. Some people use every day and experience little to no negative consequences or are functional, and some people use more sparingly and end up with more severe consequences. That's another issue, is diagnosing a substance abuse problem based off of just consequences, especially because consequences can also depend on things like status and drug of choice. For example, if you're wealthier, it's easier to hide your addiction due to financial capabilities and connections to lawyers or the state. Also, if your DOC is meth versus alcohol, just think of the fact that mere possession of alcohol is a felony. Meanwhile, drinking alcohol if you're over 21 is legal. Additionally, nicotine. That's another example. Being addicted to nicotine is a problem, but because the addiction typically doesn't spiral the way an alcohol addiction might, people undermine it as not being as serious of a problem. I also want to include that addicts aren't inherently reckless individuals. We come in a variety of forms, just as an average individual might. What people don't understand is that many of us are struggling with severe mental health issues or trauma and don't know how to manage our pain. The thing is, drugs are an extremely powerful coping mechanism. I'm not saying they're good or bad, but you have to think about the reality of using substances. You are literally putting a chemical into your body, for example, like alcohol, that directly reduces anxiety, produces euphoria, and lowers inhibitions. Who wouldn't want to feel happy and like they don't have a care in the world? We're not crazy for relying on drugs as a way to survive, because the thing is that drugs actually work. Well, they work until they don't work. Most of us turn to substances and find that they help us hold on in a world where the ground is always shaking. But unfortunately, what happens is that what was once helping you survive slowly starts to kill you. What was once adaptive becomes maladaptive, and that's the hard part. You become stuck in a cycle looking for relief in a product that only brings back your pain, but now it's on steroids. Because when you take a substance, you immediately block the emotional wave's peak and refuse to ride out the emotion. Therefore, when it's interrupted and not allowed to fully take course, the unresolved wave comes back but stronger. And addicts don't just feel better when they use, they feel better the moment they decide to use, because they know they're finally going to breathe a sigh of relief. That's why the entire process of obtaining the substance and setting up for use can be as addictive as the actual high itself. Ultimately, substances deplete our ability to have control, and that's one of the hardest parts. It feels so shameful to be an addict because you're so frustrated and angry with yourself for perpetually ruining your life. You see how excited everyone gets when you have a couple of days sober or a couple of weeks, and how incapable you feel of telling people that you lapsed or relapsed for the millionth time. It's exhausting to have to keep picking yourself up over and over and over again, having to repeat the same old story to your loved ones. Feeling so deeply ashamed that you just decide to lie about your use even though everyone around you can tell. Being an addict is such a lonely path, and unless you've ever been there, you just wouldn't understand. But I also want to tailor what being there means, because many people have substance abuse disorder and don't know it because they have a certain image of what addiction must look like. You don't have to burn your life to the ground or lose people in order to have a problem. Substance abuse comes in many forms, and it's important that we are honest with ourselves. This is a complex disorder that requires honesty and compassion.